Could you present yourself?
Sure. Hi, I'm Alex. I'm from Germany. I study at the Julius Maximilians University in Würzburg,
Yeah.
and I'm in the third year.
Third,
studying.
Yes, so same counts for me. I'm Felix, and I study with Alex.
Yeah.
So yeah, and we're in the third year.
Yeah.
So still at the beginning, still
Yeah.
have some time to study, and now
Yeah.
we're here for an internship for
Yeah,
clinical
you're
rotation.
in St. Joseph's in Moshi. Why did you pick this hospital?
So actually, it's like quite popular at the moment that people are doing an internship or clinical rotation in Tanzania. And most of the people go in Moshi to KCMC.
Yeah.
We thought about that. That's like the big university
Yeah.
hospital.
Yeah.
But we heard and read some reviews that it's really overloaded with international students.
Uh-huh.
So therefore, we decided to go to another hospital. And
Yeah.
we read in a forum really good reviews about St. Joseph's.
Yeah.
It's like a small
Yeah.
district hospital, and
I guess they must be really pleased to have you here. You know, when it's a smaller hospital and
well,
Yeah, of course. I mean, they're just 4 departments
Yeah.
with not too much doctors.
Yeah.
So that's why we thought the supervision is going to be really good.
Yeah.
Which has been always the case.
Yeah.
We had a good supervision. We made even some friendships with the local students.
Yeah.
They invited us for lunch. It
Yeah.
was really nice to stay with them, and they explained lots of things, especially because mostly the patient interviews are in English and
Yeah.
in Swahili.
Uh-huh.
And they then after it translated for us in English,
ah.
so that we know what's going on.
So how are you communicating then, like with the patients in Swahili, or is it just? Do you have someone with you when you're doing your morning rounds?
well, that's sometimes, to be honest, a bit
A
difficult.
bit of a challenge,
So
yeah.
in general, they speak Swahili
Yeah.
with the patients, and the doctors and all the students speak like a mix of Swahili and
Yeah.
English. But well, if you just ask, if you're eager to learn,
Yeah.
then they answer you everything. So it's
That's
totally
good.
fine. But you have to ask.
What about your normal day? Could you maybe describe what a typical day would be like?
Well, mostly the day starts here at 7:40.
Yep.
The morning prayer. If you want to attend it, you
Yeah.
can attend it, but you don't have to. We did it several times. It was also interesting, but it was in Swahili, so
Yeah.
we didn't understand that much.
Yeah.
So mostly they start at 8 o'clock with the morning report, and most of the staff, like the doctors and nurses, they gather in a special room for the morning report, and yeah, they discuss the new cases they have. And after that, there's some free time just to
Yeah.
have a look over the ward and get in touch with the local students.
Yeah.
And around 9 o'clock the morning, the rounds start on the wards. Yeah.
So it's a good choice to come here then.
Definitely.
Definitely.
It's a good experience.
And what about your education? Are you feeling that you're able already, after in your third year, to be able to use all the knowledge that you've got?
Well, I mean, to be honest, we're still at the beginning of our studies.
Yeah.
So especially if you see it from the clinical part
Yeah.
of you, so it's more watching and more
And-
like
and
getting
learning and-
experience,
yeah.
gathering some experience.
Yeah.
But it always helps and it always educates you. So it definitely helps.
Oh, that sounds great. And what about when do you get off on the day? Do you have to work long days, or you?
It's totally up to us.
It's up to you guys,
Yeah.
okay.
Mostly we stay till 1 o'clock.
Yeah.
When rounds are done, sometimes we went to the theater
Yeah.
to attend some surgeries,
Yeah.
which was really interesting to witness that.
Yep,
as
I bet.
Especially when you compare it to the
Yeah.
German system that we are used to. And after that, we mostly met with the local students for lunch.
Wow, that must be a really good experience actually doing that. Wow.
Yeah, absolutely.
So then it means finishing at 1 o'clock, you might have some free time then to look around Tanzania. Have you had a look at any interesting places here in Tanzania?
Yeah, definitely. So in Tanzania, you can do a lot of stuff. There's a lot to see.
Yeah.
So, for example, hiking, going up to the Kilimanjaro, Mount Meru. We've
Yeah.
been there. There was totally amazing.
Oh, you went up Mount Meru?
Yeah, it
Wow.
was beautiful. I can definitely recommend that.
Yeah.
And safari, of course.
Yeah.
Yeah. And a lot of other stuff, like seeing the nature, some waterfalls. There's enough to see. You don't get bored.
No.
There's also a lot to do around Moshi, which is,
Yeah.
there are lots of tourists here, also international students for
Yeah.
the KCMC,
Wow.
a lot of tourists who want to go up to Kilimanjaro, and Moshi is kind of the town where you start this adventure. So there's a lot of things going on in the town. There are nice restaurants, of course. You can do sport. You can do daily trips.
So the nightlife's not too bad either then.
It's really good.
It's really
there's some karaoke where lots of international students meet, and after then you can go to a club.
Yeah. Oh,
And the
that's
locals
great.
can dance, I can tell.
Yeah, the locals can dance. Yeah, they can dance. Okay, Guy. Any last comments to any of volunteers out there that are thinking of coming? Is it a good idea?
Well, I can recommend it.
Yeah.
Even though sometimes you're just watching and you
Yeah.
can't really do something by your own
Yeah.
or by yourself. But in general, it's a really good experience to see something. You really get to appreciate probably your own system back at home.
Yeah.
Like how lucky we are sometimes that we can afford this type or this kind of medicine we have in Europe.
Yeah, it puts it into perspective. Eh?
Yeah, exactly. But still, it's like really interesting to see how medicine is done here.
Yeah, absolutely. The same can't be. It was so interesting to be here, and we are really happy that this opportunity was given to us to do it. And we will definitely come back to Tanzania.
Well, guys, thank you so much for this interview.
You're welcome.
You're welcome.